Hi, welcome back to Golden Owls TV. I'm your host, Avery Brooks, and today we're here with Dr. Diane Bowen. How are you?
Great, thank you.
She is the founder and director of Centered on Wellness, and we're talking all about wellness today. Dr. Bowen, tell me, how did Centered on Wellness come about?
Well, it was a process that happened over my 20 years in practice. It started when I was taking care of women who had had breast cancer. And they were coming to me and referred to me for breast reconstruction. But as I was evaluating them for surgery and for their ability to heal and recover from that surgery, I was doing certain nutritional labs. And I was seeing a consistent pattern in which these ladies were depleted in vitamin D, they were depleted in their B vitamins, and a lot of them had other issues that they would tell me about, such as constipation and things like that, which indicated to me that as a whole person, they were not at their best. Now, that was sort of obvious because they'd had a recent diagnosis of breast cancer. But for them to heal well after surgery, I felt that, and that's how I was trained, that my job was not just to take care of their body part, but to take care of them as a whole person. And so I did that as best as I could, given that there's just me. But in the past couple years, my goal has been realized is to bring some like-minded providers as part of this process and to create Centered on Wellness so that we could take care of the whole person. And then as I took that concept and I started investigating the other folks, men and women, who were going to have a surgery, I found, lo and behold, they were also low in vitamin D and low in B12 and low in magnesium and low in zinc. Sort of consistent patterns in which people appeared to be relatively healthy, but so they were, as we would say, well fed but malnourished. And so there are techniques and ways in which we can measure a person's nutritional status, and so then that was a tool that I was using to assess someone's wellness.
Wow, that's so interesting. Kind of one thing leads to the other.
Sure.
And getting to the bottom of it. And
right, and I think plastic surgery is unique of many of the surgeries in that indeed it is truly a general surgery. So in the course of any one day, I will see a young child that's perhaps been bitten by a dog, and another part of the day I'll see someone who's a senior citizen dealing with skin cancer, and of course everything in between, from the cosmetic as well as the reconstructive side. And so because of that training, my outlook, unlike maybe some of my colleagues who went into specialties like gastrointestinal medicine or cardiology, which is a very organ-focused way of doing medicine, plastic surgery basically gave me the foundation to look at the person as a whole person and to assess them in terms of their entire person and their wellness.
Right, so you really focus on whole person wellness.
Sure.
That's excellent.
And I think that that is something that is going to be a paradigm shift in medicine as we realize that, of course, we all know that we're not walking hearts and lungs and livers. But I think that hopefully as more and more physicians have this understanding of the essential connection of our intestines to our heart, our mouth to heart disease, that you can't just treat organs in isolation, that you need to look at the entire person as integrated, which of course we know that we're all attached, but we just tend to look at each other as, in medicine, as being body parts.
Absolutely. What types of services do you offer here at Centered on Wellness?
So at Centered on Wellness, we offer a wide variety of services focused on wellness. So number one, we do a comprehensive nutritional assessment, and that helps people understand how well are they utilizing the foods that they're taking in, the supplements they're taking in. So many times people will say, well, I take biotin because my neighbor across the street took biotin and it really worked well for her hair. Or why do you take fish oil? Well, Dr. Oz said fish oil is really good, but what they don't realize is fish oil acts like a baby aspirin. So if you're taking fish oil plus a baby aspirin, no wonder you're ending up with significant bruising and injuries to your hands. So that the first part is sort of a nutritional assessment, a whole personal assessment. So that's one aspect of what we do. And then that logically leads into sort of bioidentical hormone balancing. I think, again, as I learn more and as the medical community learns more, I will say the sex hormones do a lot more for us than just help us enjoy our significant other. Sex hormones, estrogen and testosterone, both men and women make those hormones, and it's the ratio that makes the difference. And so obviously, hopefully a man has a little bit more testosterone than a woman, but women, I will say, ride more of a tidal wave of hormones over their lifetime, and it seems to, obviously it peters out as a woman enters into menopause. And so that makes women in general more vulnerable to things like hip fractures and Alzheimer's. And so I think understanding that the sex hormones play a role in how our brain works, on basically how our entire body works, that is a key part of the notion of bioidentical hormone balancing. I see a lot of, again, in just my general surgical patients, a lot of people have sort of symptoms of low thyroid functioning. You'll notice I've seen women who have thinning of the outside edge of their eyebrows. That can be a sign that's called a Queen Anne sign. That's a sign of a low thyroid. And sometimes I will ask them, I'll notice that, and I'll say, well, does anybody in your family have thyroid issues? Do you have thyroid issues? And they'll go, well, how do you know? And I'm like, well, because that is, sort of the Lord gives us some external signs of what's going on internally. And then the third key part that sort of ties it all together is we do what's called IV nutrition. Now, why would you bother to put nutrients, vitamins and minerals into your veins if you can eat them? And that's a very good question. That's because for some people who are either recovering from an illness, either dealing with an illness like a cancer, or people who are trying to recover from a very strenuous, we'll say a marathon, they can't eat that food fast enough to get it in when they need it. And then, as we talked about, sometimes if your digestive tract is not working, the bottom line is over time, none of our digestive tracts work as well as they did when we were 20, then you could be eating the most organic, healthy food prepared most perfectly, and yet your body's not able to absorb it properly. Now, most of the times, the general person that I will see is taking medicines, things like metformin, which helps people with diabetes, and they're also taking things that are called proton pump inhibitors that's used for reflux. And even medicines that we take that do good for us can deplete us of some very key vitamins. And so then that sort of circles us back around to why do we do a nutritional assessment. So basically those three things, nutritional assessments, bioidentical hormone balancing, and then IV nutrition, are a perfect triad to help someone achieve their best.
Wow, it sounds like it all works really well together and makes for a whole person wellness.
Well, that's our goal.
How is this medical facility different than, say, a primary care facility?
And that's a very good question. This facility is different because here, of course, we keep saying the word wellness, but that's what it's all about, is that we are centered on your wellness. The way modern insurance works, it's a very illness and sickness management focused healthcare system. Unfortunately, in Western medicine, which is certainly how I was taught, if you have hypertension, you automatically are be given a pill. And there's very little counseling as to changing your lifestyle. If you have diabetes or prediabetes, you're automatically given a pill, and there's very little counseling. Now, part of that has to do with, we'll say the insurance world, which would be a primary care provider, would be in the insurance world. In the insurance world, because of the vast changes in the administration of medicine and the bureaucracy of medicine, healthcare providers, physicians, nurse practitioners have less and less time to actually have an encounter with someone. In some institutions, basically the healthcare providers are told you have 7 minutes to have an encounter with this person. Well, 7 minutes is barely enough time to say, hey, how are you doing? Are you having a good day? Did you have any problems finding the office? Much less get into a complex medical history. And so as a result, that sort of funnels that discussion again to an organ-focused thing, which is where, hey, Mrs. Jones, I know you have lots of stuff going on. We can only discuss one thing today. And so that's the difference with us, because we're focused on accomplishing wellness. We have the luxury of taking the time to discuss this with the patient. And because of that, the financial model is different. Again, insurance reimburses providers for managing someone's sickness, but they don't reimburse providers for managing their wellness, and that is what we do here.
So, Dr. Bowen, how can the community utilize the service here at Centered on Wellness, and do they need a referral?
That is excellent. No one needs a referral to come here, but certainly our goal is to partner with our medical colleagues in this community, because that we understand that they are time limited and that they need to be focused. Our goal would be to come alongside with them. And so examples would be like if someone knows that they're going to need to have a joint replacement or some sort of orthopedic surgery. Certainly there's lots of literature out there that shows optimizing nutrition prior to a surgery will help someone's recovery be faster and have less complications. I just think it's funny that we do research to, I guess, prove things that are intuitive, right? It just makes more sense that if you are malnourished and have a major surgery, you're not going to have as smooth a recovery as if you're properly nourished, okay? So I think that this is somewhat of a new concept to this community, this notion of focusing on wellness, but if you just get on the internet and look at maybe slightly larger communities, this model has been adopted, all over the nation. And certainly at a lot of larger medical centers like MD Anderson and Duke University, those institutions have all recognized the importance of wellness. And it comes under different titles. So sometimes you'll see the word integrative medicine, you'll see lifestyle medicine, you'll see functional medicine. All of those phrases basically have at their core and their foundation this notion that how we are nourished, how we are hormonally balanced, all plays a role in our ability to recover from major surgeries, major illnesses like cancer, and from strenuous athletes, strenuous sports events.
So everyone can benefit, really, from Centered on Wellness, whether you're going into a surgery, whether you're an athlete, or just somebody who may need some balancing of hormones and nutrition counseling.
Absolutely, because we know that motherhood is a prime example. In the past there was sort of this, you're just a stay-at-home mother. Well, what I can tell you is I admire all those women that are stay-at-home, because that is one of the hardest jobs ever. And I think that in the past, a pregnancy is a very strenuous event. And I think that there was this phrase like postpartum blues, and a lot of times, at least in the past, was sort of dismissed as, she just needs a little anti-anxiety medicine, and maybe she needs a little help taking care of the baby. But what we now know is that that event of pregnancy and delivery is a profoundly stressful event on a woman's constitution. And if she's going into that just a little bit unbalanced, that can really push her literally off the deep end. And it is not just a mental thing. It involves her whole body. And we now know that our gut is our second brain. And so a lot of times when people are exhibiting, we'll say, mental issues of stress, anxiety, depression, the root cause has to do with that their gut is just not working at its best. Wow,
that's fascinating. We don't really think to put the two together.
No, we don't.
But it certainly does affect everything.
Sure it does. And that's been part of the joy as I've sort of partnered with like-minded providers in this community, and going to meetings is knowing that there's other physicians and providers and other specialties who recognize this fact, which when you think about it makes sense, that we're a walking person, and all these organ systems are connected, and you cannot have dysfunction in one part of your body and it not have triggering, cascading effects on other parts of your body.
Absolutely, yeah. It all works together, and we're so glad you're here, and this has been great information. We so appreciate your time today.
Okay, well, thank you so much.
Thank you. Hi, welcome back to Golden Isles TV. We're here at Centered on Wellness with Lauren Koncul. How are you?
I'm great, thank you. How are you?
Good. So you are the nurse practitioner here.
That's correct. Yes.
So you're really very hands-on.
Absolutely, yes.
When it comes to the patients.
We are, yes.
Great. So tell me what types of services you offer here.
Well, we offer a very holistic, patient-centered approach to patient care. We have IV nutrition, we have nutritional counseling, bioidentical hormone replacement therapy, stress management therapy. A lot of different, very specific, patient-centered, holistic approaches to healthcare.
Right, so you're not treating just one thing, but really the whole person.
Absolutely, yes. We try to stay away from just treating symptoms, but really want to get to the root cause of patient problems, and as well as preventing any chronic illness.
Right, absolutely. What a great approach.
Yeah, it really is. It's very innovative. It's a great approach to patient care and to health care.
So Lauren, tell me the differences between bioidentical hormone replacement therapy and just hormone replacement therapy.
Well, bioidentical hormones are a more natural approach to hormone balancing. They're derived from plant sources. We are able to bring patients in, evaluate their exact levels of what their need is for hormones. With bioidenticals, we can dose everything exactly to what patients need in comparison to synthetics, where the dosages are already set, and typically the levels aren't checked prior to administering synthetic hormones. There's less risk with bioidentical hormones because they are an exact replica of what the body naturally produces.
Mm-hmm. Yes, just a more natural approach.
Exactly.
Yeah.
We want to keep our treatments as natural as possible.
Mm-hmm. That's great to hear. So Lauren, tell me about nutrition management. How does that work here at Centered on Wellness?
Well, patients are brought in and we do a very thorough evaluation. Everything is based on lab work to find specific depletions in nutrition. So with that information, we're able to do dietary counseling, IV nutritional therapy, supplementation recommendations, and weight loss support and management. It's very patient-specific therapy that we're offering.
Right, and it sounds like once again y'all are really covering the whole person.
Exactly.
Because wellness is
our goal.
Mm-hmm, absolutely. So Lauren, now we're going to talk about IV nutrition. Can you tell us how that's different than just taking like an oral supplement or a vitamin by mouth?
Well, the IV nutrition, again, is based on patients' exact depletions that we've evaluated through lab testing. We formulate their IV bag with the exact nutrients that they require based on that lab work. Everything is mixed here in our facility with our specialized equipment. The IV nutrition is placed directly into the bloodstream. So you're bypassing the GI tract and optimizing absorption. Some patients will use it for chronic fatigue, just general wellness, certain chronic disorders that leave them depleted. So it's a great way of optimizing nutrition and making sure that we're not losing any of those vitamins and minerals that we're trying so hard to supplement with.
Right, it's always also a quick way of getting nutrition.
Absolutely.
It's a really effective way, but also a very fast way to get nutrients. To maybe run a marathon or something like
Many
that.
athletes will use it to recuperate and to optimize their athletic abilities.
Right, but then you also might want to continue with oral supplements, vitamins when you get home, maybe in between the IV.
Absolutely. Good diet, oral supplementation, IV nutrition, it all works together to optimize wellness.
Okay, absolutely. Well, thank you so much. This has been great information, and we so appreciate your time today.
Thank you so much. I appreciate you having me.
Thank you. Hi, we're back here at Centered on Wellness, and I'm with Meghan Johnson. How are you?
I'm good. How are you?
Good. You are the office manager for Centered on Wellness.
I am, yes.
That's a big job.
It's on some days. Yes.
Well, tell me about what patients can expect the experience here at Centered on Wellness.
So at Centered on Wellness, we're a little bit of a different environment than your traditional medical setting. We're located on St. Simon's Island, across from Epworth Marina. So even from the moment you pull up to the office, it feels more like a vacation escape. You know, you have the beautiful hanging moss, and I think that just sets the stage for what you can expect. When you enter into our building, we like to think of you as our guest within our home. We want you to feel welcomed. Most of the time, this isn't the type of place where you're coming in and you're sick and you don't feel good. And then it's like the drab gray walls and a very sterile environment. Ours is really more of a warm and welcoming feeling, as if you were walking into your best friend's living room. And we want for you to feel that way.
Yes, I do feel like it's so comfortable. Really, it puts you at ease. It's a wonderful environment.
Good, thank you. I'm glad that you felt that way when you came in today. That's our goal. We want for our patients to feel like they are our guests, because that's what it is.
Yes. So how would this experience at Centered on Wellness be different from, say, a primary care provider?
Mm-hmm. So at Centered on Wellness, we focus on the whole patient. We want for there to be beauty on the inside and the out. So typically we know from medical science and all the studies being done, what you see on the outside is also a reflection of what's going on the inside. So we want to be a resource to work in partnership with, let's say, primary care doctors or orthopedists, or even oncologists for that matter. The idea is, if a person is not feeling good, chances are they're really depleted nutritionally. So if we can get them where their nutrition levels are better, or at a more optimum level, their healing, their recovery, their treatment will all go that much smoother. Our idea here is for the patient to come in and understand, we don't just look at you as a heart or as a liver or as a GI tract. You are a whole entire person, and we want for that whole entire person to feel good.
So Meghan, tell me what services are offered here at Centered on Wellness.
First piece is we bring you in and we do a very in-depth nutritional evaluation. So think of this similar to when you're going to go on a car trip. You would go and check your oil. You do the dipstick, right? You dip the oil, you wipe it off, you make sure your levels are good before you go on a long road trip. We do a similar concept here. We dipstick your nutrition. We want to make sure that where your levels are sitting are in optimal places. And if there's anything that's lacking, we want to help you get that back. The whole idea behind this is, you might be depleted in one thing and I might be depleted in something different. But if you just came into our facility and we gave you the same thing that we gave me, you might not need that. So that's the whole idea. You're not going to just, for example, back to the car with the dipsticking, you're not going to just automatically add 5 quarts of oil and you didn't check the levels. We do the similar concept here. From checking your levels, we then determine what's the best course of action for you, and it's very tailored specific. So we focus on nutritional management. We also take a look at bioidentical hormone balancing. And then the last piece to the puzzle where the three interact is from IV nutrition.
So it sounds like it's really an individualized approach.
Yes, very much so, because no person is created the same, no person is dealing with the same malnutrition or maybe just a little depleted in one area. Every single person is different, and we want to make sure that they're treated accordingly.
Right, so you get a plan for each individual.
Yes, very much so.
Absolutely. So Meghan, this all sounds great. I know we would all love this individualized wellness care, but what does it cost?
So I think that's like the $1 million question, right? So with Centered on Wellness, we take the approach of wellness and prevention, which is not the same thing that's recognized by most insurance companies. They are more disease focused and illness targeted. So with that being said, unfortunately, we don't accept insurance plans to be able to do some of the treatments that we offer here. However, with that being said, This is very affordable. It doesn't cost you millions of dollars to come in and make sure that your nutritional levels are well. Your labs will be covered by most insurance companies. Us going through very in-depth analysis of what your labs tell us. We spend anywhere from 30 to 45 minutes, sometimes an hour, talking with Lauren, patient to provider, which I don't think that's ever heard of in most doctors' offices. You kind of feel more like, okay, I got to get in, get all my questions out, and get back out again. So we really take the time to walk through it in detail. And then the other piece of things is we have a few different avenues. So let's just say you don't want to pay it directly out of pocket. We offer something called Care Credit, which is done through a third-party company. Think of this as your health and wellness credit card. And then a lot of times, depending on how much you're putting onto that card, they offer different promotions from anywhere from 6 to 18 months interest-free. So that's a really nice piece that a lot of our patients take advantage of. And all of this would encompass and fall under qualifications to utilize Care Credit. But like I was saying to you, everything really is very affordable. We want for this to be a resource that our patients and our community can take advantage of because we realize the benefits behind it. The other piece that I always encourage people to remember is if you're healthy, if you're on the right diet, if your nutritional levels are well, even though you might have spent money to do that, chances are you now won't have to spend money to go for a hospital visit. You might not have to have surgery. You might not have to be on medication now for the rest of your life. So if you take the cost of all of those things that insurance does cover, but you still have deductibles and co-insurance and things like that, we might be able to save you a lot of money. So that's our goal. That's really what we want to target. We're all about the wellness and the prevention side of things. We would love it where if you had to just spend that little bit of money with us, we balance your hormones, you might not need to have all that other medicine involved. Same thing for nutrition. You know, you might do a series of IV nutrition with us. We get you caught back up. You're feeling great. Maybe you don't have hair loss. Maybe your nails aren't so fragile. You're not dealing with a chronic pain anymore. That's our goal.
Right. It really seems like in life this should come first before the primary care physician, because you want to make sure you're balanced and the hormones are right and you've got the nutrition to set you on the right path.
Exactly. We want to work in conjunction with that primary care doctor. We want to be an additional resource for them and for their patients. So we really encourage the community, you know, as you're seeing your doctor, if this is something that you want to take advantage of, you don't need to have a referral to come to see us. However, you can ask them, you know, is this a good avenue for us to take? But by all means, you can still come in and take advantage of our services without needing a referral.
Right. So it's great to work with your physician to enhance what he might be doing.
Exactly.
But also you can come on your own. So that is great to know, and good to know that it's affordable as well.
Yes.
So thank you so much for your time today.
Thank you. We really appreciate it.
And tell us once again how we can get in touch with you. What's the best way?
So the best thing to do, you can absolutely visit our website at www.centeredonwellness.net. You can see in detail all of the services that we offer, all of the different IV infusions that we do here, in addition to getting some more information about the providers. If you visit our website, everything sounds good, you really want to move forward with coming in for a meeting and start your process with a consultation or your lab work, you can give our office a call, and that number is 912-638-0034, and we'd be more than happy to get you an appointment. We're here Monday through Friday from 9 a.m. to 5 p.m.
Sounds great.
Yes.
Thank you so much.
Thank you for having us. We really appreciate it.